We will now go to the next presentation in the printed diagnostics and 3D printing session related to the smart insoles. So Eero, let's go.
All right, thank you, Ilkka. And good afternoon from my behalf. So my name is Eero. I'm a CEO of MoveSole, and I'm going to share with you some thoughts about the wearable devices in preventive healthcare and also in welfare, and using our smart insoles as a case example for that. But before going there, it's why we speak about the wearables in healthcare and welfare. I think it's good to remember where we are coming from. So if you think the healthcare in 50 years ago, so if there was a test needed from a patient, what happened was that you as a patient went to a hospital, whether it was far away, whether it was close by. There was some tests taken, and then there was a wait for days or weeks, and then you went back to the hospital and listened to your verdict, whether you will be surviving or not. So it was quite a complex, and it was also time-taking and expensive process. And now, I think the first thing which started to happen in maybe 40 years ago already was that the people with the diabetes, they started to take their own blood tests in order to find out what was the level of the glucose in their blood, so that they didn't need to go every time to hospital. And on the welfare side, the one of the first pioneers were, of course, the Finnish Polar with the heart rate monitoring, where the people in sports, in the beginning, it was like a top sports, you know, they were almost a professional sport people who used, but it started to go for normal people who were interested about how the exercise was going. And in the last 10, 15 years, that trend has been growing faster. There has been activity measurement, there has been sleep detectors, how well we are sleeping. And there's more and more need for objective data in both in our welfare, but also in our healthcare. And here I'm using it's a case of the MoveSole. We're developing smart insoles for gait analysis. So gait analysis is the way how we walk. And it's a good example of where the healthcare is going. So 50 years ago, they was thinking that there's one good way to walk, and basically it was thought that every human being should be walking in the same way. But now it's more and more started to understand that there's not one right way to walk, but there is a natural way for each individual to walk. And also the relation between how we walk or what kind of our gait is to various problems, not only in the feet or knees or hips, it's even in the back. So there's a lot. The relation between our walking and our welfare is very strong. And even more so that there was also thinking that the way you walk is the way you walk, and you can't learn anything new. But nowadays it's learned that you can even teach to walk in the different ways. So there is need for a objective data for the walking. It can be measured, and the results can be used in analyzing and helping people to feel better. And one of the key elements is that it can be used in rehabilitation, but it can be also used preventing something to happen. So that is one of the key findings in gait analysis in the last 20 years. And just giving some ideas how different cases there are. So where we started from was we originally built these insoles for physiotherapists helping people recovering or rehabilitation process of lower limb injuries. But we have been soon learning that there's so many other places like the lower limb malfunction and the other things, which are not like a trauma type of incidents, but rather that there is a long-term back pain problem, and maybe the physiotherapist can help, where the data of how you walk and how you are training is helping you. But then there's other things like diabetes, then there's a sports, exercising, and especially with the older people, the prevention is very important. So the walking is a very good way of analyzing how well is your condition, and if certain intervention is affecting on that condition. And the latest findings, which is still a little bit like a science fiction, but it's getting there, that how we walk in the elderly age is also marking. So let me put it the other way around. The starting of the Parkinson's disease can be seen in the first phase. You can see it is in your walking before any memory type of problems exist. So that is the key. So and so far, the physiotherapists and orthopedists, the only tool they have had in analyzing with the gait has been their own eye. And they can see quite a lot with it, but not all of it. So when speaking with the physiotherapists and orthopedists, they say that they need more accurate data of the walking and the way it is to measure what happens under your feet. And that's where our insoles have been used. And even going further, it's really a huge research going on a gait analysis, and originally it was needed for a clinical examination and then helping tour, and that's where we started, and that's what we're selling it for. And there also the other finding is that you should be analyzed while you're walking, not while you're standing it. So if you tend to, and still if you go some of the physiotherapists, they put you standing and they check your feet, but in the real life, there's more and more research saying that you shouldn't be analyzed when you're standing, but rather when you're walking, in order to understand what's wrong when you're walking. And more and more, there's a finding that the shoes, what kind of shoes you have in your feet when you are in a working place or when you are jogging or running or walking, it has a huge effect how you're doing, and to measure what is the right foot where you need the data under your feet. So if you think it today, so still it's mainly the measurement of the gait analysis done in the labs, and that means they are in the hospitals or clinics, and there are not too many of them in the different places. Like in Finland, there's like 5 or 6 good laboratories for a gait analysis. So it means not everybody can go there, or if you go there, you have a problem you are solving there. So, and our mission is to take this kind of measurements to where you live. So basically, in your everyday situation where the problems happen, whether it's your work, whether it's your running, whether it's how you behave at home, whatever you do, we want to take the measurements there. And again, like I said, there's so many places where you can use this kind of measurement. So it's not only like a rehabilitation of lower limb injuries, but it's sports, it's diabetes people, measuring people with older age, and it's also occupational health. So basically, a lot of the pain problems or back problems and pain in the back are coming from what happens at the work. And in order to understand what happens and how to improve the situation, you need the data, how to measure it. So going to products that we have. So what we did was that we wanted to build a easy to use insole that you can take to wherever you want to measurement taken. So we are measuring forces under the feet with the 7 different force sensors. And so basically to take it wherever you want it to. So what we did, we integrated 2 hospital level or laboratory level tools. So the one is the pressure mat and the other one is the force plate, and integrated to them into one insole so that it can given to the patient, and then let them go wherever you want them to be measured. And then the only thing they needed with them is the smartphone with the application which collects the data from the insole. And so basically, I jump to the next one. When we started this process, the original target were the physiotherapists and orthopedists and podiatrists. So we wanted to build a application which is as easy to use as possible. So whatever is the result, whether you want to see how the weight is split between right and left foot, or whether there's what kind of your step is, how strong is your heel strike, or whatever you are looking for, the results can be immediately seen. So we don't steal the time from the patient and the physiotherapist said, so they can talk and our measurement comes as fast as possible. And the other finding, there's a lot of asked question from us, is that could you make that list like an artificial intelligence so that it tells directly to patient or the people using them that whether they are walking right or wrong. And one of the things we have been learning to, because every people are walking, there's not one right way of walking, but there's a natural way for each individual walking. So this is a professional tool where the professional can help. It helps the professional, and then the professional can help the patient change something or improve something, and rather than the tool itself or the insoles themselves could tell it. But while doing that, what we have been learning also, like I said in the beginning, that it's not that there's a one way of the walking, but there's a natural way of walking, and that can be changed. And that's one of the things what we have been learning or doing now with our insoles. So using these insoles also to learning something new. So basically we can put alarms in under your feet in the different sensors, and let's say that you have a little bit too little pressure on your biggest toe, we put your alarm saying that every time you put too little pressure there, it reminds you that you should change how you walk. So basically, we use biofeedback for teaching people the new habit of the walking. And very small changes can affect a huge amount for the patient's everyday living. So basically, this is where our tools are used a lot. So we use it not only measuring and collecting the data from the patients, but also teaching the patient something new, the new way of the walking on the way the physiotherapist or orthopedist thinks they should do. So what basically the key element for us, there was like a 3 or 4 important things for us when we were building the product. The first was because the forces under the feet, it's got a violent environment. So we need to build a product that lasts so that we can sell it to that they can use it from one patient to another one. The other one was the usability of the product. So usability in many senses. So it's easy to put on the patient's feet. It's easy to measure the result. The results come fast. So it doesn't steal the time of the patient physiotherapist or patient doctor relation, but it just gives the result as when they are needed. And then precise measurement results. So we wanted to build a product that gives the results you can rely on your healthcare on. So basically, we wanted to give what we call like a laboratory level results, and that's we have been working a lot, and it has been validated by external resources, so that we know. And you see there, so we give this insole like a 12 months guarantee or 500,000 step guarantee for one pair. And that's something that's not seen in this business. There has been some other insoles earlier, but they typically have had like a 5,000 step or whatever guarantee, but we give a warranty for 500,000 steps. So we give a tool that can be really used for measurement. And finally, here can you see our product. So we're selling this to professionals. So it's a package including 6 different sizes of the insoles, 1 smartphone, including our application. You can download it elsewhere, but we guarantee that this one is working, and then all the other needed stuff. So that's in a nutshell what we're doing. So we have really built a product for wearable product that you can be used for measuring the patient and the patient's walking on wherever they are living in their everyday life, and collect the data, not only for the healthcare, but also for the welfare purposes. So if there's any question, I'm more than happy to answer those.
Okay, thank you, Eero. I can see that there are no questions at the moment, but based on your presentation, the world is going to that direction that instead of asking that, how are you, we should ask, how are you walking?
Pretty much. There was one very experienced physiotherapist who said to us when, by the way, he's our customers nowadays. So he was saying that if you have a pain below your neck, it has probably something to do with the way how you walk. So walking is affecting very much to our everyday life.
Yeah, I think so that there has been quite many of this kind of let's say startups and research products and that kind of topics, which have this kind of outcome of an insole. And but there are, like you mentioned, that there are not too many competitors at the moment who are giving this kind of figures, what you guarantee, this 12 months or 500,000 steps at the moment. So can you comment a bit the journey?
Yeah, yeah, that will take another 20 minutes. No, seriously, it was so giving this way that it took us only like 3 months to build a first prototype that measured something, but it took us like 3 years to build a product that, first of all, is precise enough so it's measuring right, and the other thing was that it's usable and it lasts for long enough. So it was really a long journey. Ilkka knows pretty much how we fought to make it working. And therefore, we like I've seen like a tens and tens of different kind of research programs where there has been planned to build an insole, but there are in real life we have maybe 2 or 3 competitors in Europe or even in a global level who are really delivering the product. So it's surprisingly difficult task. Let's put it this way.
So what about at the moment this kind of different lines for the research? As you mentioned that there are a lot of different kind of, let's say, topics which you can measure and different age of people and so on, which you can detect different kind of topics. So you are involved in different research topics at the moment.
Yeah, pretty many. It's well, starting from the kind of the current situation, so the COVID situation, which has been hurting our business quite a lot, but there has been one development, which is that these kind of tools also allow distant treatment in a way that the insoles are sent to the patient. Patient is walking there and seen through the video, and the measurement to results go back to the physiotherapist, so they don't even need to meet. That has been one of the events. There has been a EU program where they have been already testing this kind of using our insoles on that, and it has been quite successful. But then on research side, on larger, I think the finding, it was a very big German research where they really were measuring how people walk, the elderly people were walking, and when they started to see the changes in the walking style, and then they analyzed it was like the first sign that there might be Parkinson's disease or Alzheimer's disease coming. So that is very interesting going forward. So if we could be helping people doing this kind of testing of the 70, like in Sweden, they plan to test 75-year-old people, and then every couple of years to test, and if they start seeing changes in the walking, maybe take the further testing whether there is a Parkinson or Alzheimer coming, and that is very interesting part of our future, hopefully.
Okay, thank you, and all the best for the next steps with your insoles. So
thank you, Ilkka.